Right for scissors. Number one, it is straight. Number two, it is tips. According to first characteristics, all scissors divided into these three groups: straight scissors, curved scissors, and angled scissors. So remember, if you know what the matter is, why I speak about it. Now let's understand. What do you like? Just listen my voice. Okay, no problem. Now, angular and curved instruments we use for deep structures. Remember, please, straight instrument is used for surface. Otherwise, if you will try by straight instrument to cut deep structures, you must insert with your hand. Let's continue. Next instruments, of course, it is saws. Different kind. That tool which you see we call hand saw. It has the big body and handle, and you can make incision only in one direction. If you start it, you cannot change anyhow, because bone will press this instrument. That is impossible. Second type of the saw which we have, it is wire saw. We call it Gilly wire saw. It has lock mechanism in the handles. You can remove them by special introducer. You insert it into the bone holes, for example, in the trafinational holes. And you make the sewing from inside to outside. Look, if this one is sew the bone from outside to inside, this one usually we use to make sewing from inside to outside. Of course, previously, primary, we must to drill the bone, yeah? Because I don't put here the drill because it's huge. We have electrical, we have hand drills. There are two types of the tips for the drill, with sharp point and with ball-shaped form. Sharp-pointed one we use only to perforate it external compact layer. How we understand that we are still inside of external white pieces of the bone. Then we see red piece, it means we reach the diploidic layer. We change the sharp tip and we put the ball shape. And we continue our work strongly by ball-shaped tip up to see again the white pieces of the bone. It means we reach the internal compact layer. Compact layers doesn't have the vessels. Then you reach the internal compact layer, you finish your drilling. You take the probe, like the X, you break the internal compact layer, and using the dissecting forceps, you remove the fragments of it from the wound. After this, now look in the blackboard. Please, for example, this is your drilling apertures. Usually, by the way, we make, if it is osteotomic trephination, it means you must open the box and then replace the cap in its place. You make 5 apertures. After making of this aperture, you take another instrument, which is called the raspattery. And using the raspattery between these apertures, you clean the periosteum, because you know that the nutritional vessels are not located in, except the base. In the base periosteum, we doesn't clean. By the way, base portion of the bone, we don't sew completely. We sew portionally, then we break it using the special instrument which is called elevator. You insert the elevator inside of these margins, little bit push it, and it is break the bone. All these bone structures, we cut it completely using the Gilly wire saw, except the base. Base we start to sew from inside, but we don't complete. Why? Because we need the bridge which will connect it, this flap, from another portion of the skull, and it will be periosteum. If you will clean periosteum here, you will have necrosis of this portion of the bone, because you will destroy all nutritional vessels which is come to this portion. As I remember the name of this instrument, we call it the raspattery. Exactly this one we call Farabeck raspattery. It can be straight, it can be curved. Curved for tubular bones, straight it is for flayed bones. This is also raspattery, but we call it rib raspattery, Doyen rib raspattery. By the sliding movements, we clean the periosteum from the surface of the bone. Why it is necessary? Again, to not damage vessels. If you will look in the skeleton, and we'll try to remember anatomy, you will remember that there are intercostal neurovascular bundles, which is passed along the inferior margin of the rib in the sulcus costa, and they fuse with the periosteum. So imagine that my leg, it is the rib. How I can cut it? Why you cut it generally? To make the big aperture into the thorax. We call it thoracotomy by resection of the rib. Now my trouser will be periosteum. Now imagine I cut my trouser, I open this trouser, and I cut my thigh region and remove. I don't damage the trouser after I will suture it. That's a trouser, it will be periosteum, to not damage the vessels and nerves. By the way, Gilly wire saw, we insert it into the apertures by special introducer. It is metallical wire which has blunt end and very elastic body. Then it is come and touch to the brain, it doesn't perforate it, it changes the direction.
So it will work like a direct impulse, like guiding wire.
Yes, of course. You insert it from one aperture, you remove it from another aperture, and you connected it by the handle of it. Not handle, but this loop. Handles is removed, of course. And like how you inserted the thread in eye of needle, same way you insert it into two apertures and start to make the incision. By the way, cut the bone, I mean skull bone, not straightly but in 45 degrees. Because after you must to replace the cap in its place. If it will be cut it straightly, it will be sinking down. You understand it or not? Hold your hands like this. If you will cut in that way, after you will put the cap and it will go. If you will cut in 45 degrees, it will sit it in its place. Thank you very much. Let's continue. Next instruments in group number 1, it is the bone spoon. Exactly this one, we call it Bolton spoon. Sharp margins, one side is bigger, another is smaller. You clean the bone cavities. You clean the bone surfaces from pathological structures, from tumor up to pus. Next sharp instruments, it is different kind of the needles. Primary, it is injectional needles. Secondary, it is puncture needles. And special needle, which we call lumbar puncture. Lumbar puncture will differ from just puncture needles because inside of it there are special wires. We call it madrine. Madrine has one function. It is protected lumen during your puncture. Now, how you make the lumbar puncture? From upper margin of iliac crests, you provided imaginary line. It is passed between L4 and L5. And exactly here, you inserted your instrument into so-called subdural space. Yeah, inside of subdural space, we have liquid, which we call
cerebral spinal fluid.
So you can take this liquid for investigation, or you can inject it medicine into it. For example, to make the anesthesia. It is the type of the regional anesthesia. Below this place, the person will not feel anything. But you can make, for example, pelvic surgical performance. Like epidural, yeah. If it is epidural space, of course, epidural anesthesia. Or subdural anesthesia, that is the same. Special type of instruments, which we call bone scissors. Exactly, this is the lure, this is all the shoemaker. What is specificity? They cut the flat bone, especially ribs. This one is a unique instrument we call bone nibbling, Johnson forceps. It doesn't cut, it makes smooth surfaces. For example, there are fractures with sharp pieces. Yeah, you can make it much more smooth to prevent any traumatization. There are one more forceps, which we call Dahlgren forceps. Dahlgren forceps work like the bone scissor. It is passed from down to up and cut. You inserted bone between upper unmovable and lower movable branches of it. Then you press the handle, lower branch, cutly goes to upwards and cut the bone tissue which is between. But one problem, it made the big defect of the bones. Let's say, for example, if you make craniotomic trephination, it means you will replace the bone. Don't use it. If you make ectomy, remove the bone forever, like the radical surgical performance. That is great. You can use it. How we do it? Generally, you make one aperture, and by Dahlgren, you start to enlarge it to all sides. For example, to reach the 6 into 6 centimeters. You increase the diameter using the Dahlgren, yeah? Okay.
So, can you repeat what this one was? This is the
bone cutting forceps. These forceps we use primary to cut the ribs.
Okay.
Sometimes you can cut another parts of the flat bones. For example, the iliac bone, for example, the wing of the iliac bone. We can use it, for example, for some transplantation. There are the skull defects. You can take it, you will split it into two compact layers and use it for the plastical reconstruction. In the future, we will study it. Okay? I mean, we will study these surgical performances. Useful instrument, we call it trocar. Trocar has the sharp piercing portion. It has outer tube, but of course it has a cap. Let's say you remove it, in that position you pierce the cavity, you remove this stylet, and from this you make the artificial fistula. By fistula, if you feel you bad, you can sit down.
So we insert some.
You can insert, you can remove, you can inject, you can make laparoscopical manipulation.
Can I get some water?
Or water, yeah, you need the water. Don't worry, it is nothing serious. Just give the water or something sweet if you have the candy or something. This is the low pressure. Some fortunately due to emotions, because we speak about instruments, I don't know why this will distress you. After you will cut the tissue. If even the speaking is distress you, what will be happen with you in the future? I don't know. Okay, let's continue. That is, about the electrical scalpel, or we call it electrocoagulator. It has two functions, by the way, cutting function and coagulation. It is included in both groups, and in first and in second. In both groups, I can cut the tissues except the skin. It's forbidden to cut the skin because it will make the ugly scars, burning scars. So all another layers I can cut, or I can make the coagulation of small vessels. It's forbidden to coagulate it middle or big vessels because we will have secondary bleeding. Pressure will be increased, throat will be clean, and we will have more bleeding. Let's continue. Next group of the instrument, it is second group. We use these instruments. And especially there are several instruments. I have one group. Second, I don't know, I lose. It is arterial forceps. What can I do by arterial forceps? Simply, guys, if there are bleeding inside of the wound, for example, let's imagine, this red point, it is the place of the bleeding. I see this bleeding, so I take the arterial forceps, I open this arterial. By the way, remember, please, all instruments which have such kind of construction, I use two branches of block. You will hold in that position, first and fourth finger. If it is short, your second finger, you put in the crosspoint. Your third finger, usually it's below the instrument. In that position, look at please, you turn it, you press it to the fourth finger to have the valve behind of it, and you simply open your instrument. Okay, I see the bleeding. Just I open the instrument, I put in this bleeded place, I clip the artery, or vein, doesn't matter, and I make temporarily arresting of bleeding inside of the vein. As I tell you in our lecture time, we can arrest bleeding in 4 different ways. Temporarily inside, temporarily outside. Yeah, you are correct. For example, here there are bleeding, I know the projection of artery, I put my finger in this and I arrest. Or, for example, in the extremity there are bleeding, I apply the tourniquet. Again, temporarily outside. Wound is here, I apply tourniquet here. Why here? Tourniquet can be applied only in the single bone region. Remember, please, I cannot apply the tourniquet in the regions with double bones because artery will go between them and the pressure will be impossible. That's why for upper extremity it is arm region, for lower extremity it is thigh region. Doesn't matter where is the bleeding. That is the place of the tourniquet appliement. Or finally, I can make the permanent methods. Come to me. Hold this sponge. Now I apply here now arterial forceps. Hold it, please. Hold it. Don't sleep. What after this? After this, I must to permanently arrest the bleeding. Not only suture, mainly not the suture. First manipulation we call ligation. Let's say now I ligated this artery. Look, friend. Then I start to ligate it. You must to show for me tip of the instrument. Let's say, if you will not show the tip, I will apply my ligature on the instrument, not on the sponge. Sponge, it is some tissue, doesn't matter which one. Now look, I make the surgical type of the How I make the surgical? First, my manipulation, I do twice. After I will show for you type. And now she's show for me tip, I maximally, my thread is very weak, so it is disconnected. But anyhow, I think you understand, Yes. After this, she opened her instrument, remove it, and I finish my knotting. I make second knot, third knot, fourth knot. Or, what else I can do? Again, hold it, please. I can make the ligation with suturing. Ligation with suturing. What does it mean? I take the needle. Of course, I need here also the dissecting forceps. I will fit. Now she will little bit lift instrument. No, lift it means you must lift it. but hold it here to not. And I provided below this dissecting forceps. I'm very sorry, it doesn't give the good fixation. So I will change my instrument. That is much more better. Yeah, no, you see what students is made by this needle. They destroy it completely, destroy it.
So here we have one.
It is not needle, it is the blade of scalpel.
So
This one, sir.
This one, no, don't worry, I will show. That's a look. I provided my needle behind the instrument, I fix it. Now I open my needle holder, I remove my needle. And now again, I do the same, by the way, I do absolutely same. I ligate it now, but then I provided the needle from the neighboring structure. It is fixed, the ligature in its place. Now what I'm doing, again I say you show me tip of your instrument. Very well. Now this is normal thread, it will not be disconnected, as I will show for you normally. Now you must open your instrument and remove it. Awful. Awful. It's good that you don't do something like this.
this thumb and the fourth finger. Now
How long I will wait? Help. Brilliant. You see, nothing. Hold the sponge, please. Sponge. I don't say my fingers. My fingers holding, I don't need. I continue my manipulation. I make second knot. I make, usually for such kind of the thread, I will make minimally 4-5. Why? Because it is monofilament, one fiber. That's a, if I will apply less than 4-5 knots, it can be spontaneously open. What after? I apply the scissor, I turn the side, I measure the size of the cutting portion, and I cut. This method now, how you will call this method? You will call this method permanent inside of the womb. That's it, forever inside. Thank you very much. It will not now go here. Yes. Forever inside of the womb. That's it. Look, we speak about temporal inside. We speak about temporal outside. Now I show for you permanent inside. Now what does it mean permanent outside? Now let's modulate its situation. For example, this is main artery, which is supplied this region. Inside of the, hold it please, something. Inside of the wound, I don't see the place of bleeding, I see surface bleeding. For example, burning wound, crushing wound, inflamed wound. If I don't see place of bleeding, sorry, how I can apply arterial forceps? I cannot do it. What can I do? I must to take the scalpel, and according of knowledge of my subject, I must to make incision to access this artery outside of the wound. What I must to know? I must to know each main artery position and projection to find it outside of, for example, in the face it will be the arteria facialis, arteria supratrochlearis, orbitalis, superficial. So I teach you. Now outside of the wound, you make incision, you find artery, and then you take special instrument. I don't have it. I lose it. That's why these instruments, guys, is not the souvenirs. Don't take it, please. It is absolutely resemble to this instrument, but it has hole. We call it ligature needle. We take the thread, I put the picture, you can see. We inserted thread inside of eye, then in hook shape form, we turn it, surround the vessel, we take the ligature. In opposite movement, we remove it, and we ligate it, the vessel, outside of the wound. By the way, for artery, there are rules. 2 ligatures we apply in the proximal end, 1 ligature in the distal. From these 2 ligatures, first we tie loose, second we tie strong. Why? First one decrease the pressure, second one stop the bleeding. If both you will tie very strong, necros will be happen between them, one will be loose and we will have single 1 ligature, which is not enough. Due to the high pressure, it can be clean. That's I remember, please, this by just one moment, I won't hold your finger near it. Hold your finger in that way here. What are you doing? Brilliant. Now imagine that this is, for example, vein, this is artery. You know that artery is damaged. You now must to provide it instrument. Don't do it in this stupid way. Tip will touch to the vein and damage only in that way. From non-damaged vessel to the damaged vessel, not vice versa.
Okay,
Not
sir.
from damage to non-damage. Only provided in
Damage to
such way.
non-damage. Okay.
You understand?
Okay, non-damage
From
to
non-damage
Okay,
to
to
damage,
damage, okay.
not from damage to non-damage. Because tip will attach to non-damaged vessel, intact vessel, and can perforate it simply. Thank you very much. You can be free. You can be free. Now look, let's say remember please, there are 4 methods of arresting of bleeding. And this group can be used, method number 1, temporarily inside of the wound. Method number 2, permanently inside of the wound. Then you make coagulation. Let's say this instrument, I say, included in both groups. And permanent method outside of the wound, then you open, take the ligature needle, I say I don't have it, but it also included inside of this group, and you ligate it artery outside of wound and forever. Believe me, if you apply ligature in the vessel, this vessel cannot be opened after. You destroy the wall of this wall of the vessel. What is the most important layer from that? Intima.
Intima.
If intima loses its smooth qualities, the thromb will be formed in the future and the vessel will be closed. Is it understandable for you? Very well. That's it. Of course, that is not the last time that we speak about it. Of course, all these bleedings and all possible methods I will give you in the future. But now just you remember now how we make the classification of these forceps artery. Yeah, they can be straight, they can be curved by the tip, they can be black, they can be sharp, we call mosquito. And much more important, by inner surface. You can see it can have only grooves, it can have teeth, it can not have anything. This one is bill rod, this one is torture. If nothing, we call it pean. Pean used usually for capillary bleeding, no so big gripping is necessary. Of course, grooves, of course, teeth, it is for gripping. Of course, this one will make more gripping, this one will make less gripping, but in the same time, it's more traumatic. That's why if you use torture forceps, you apply it strongly in that way, not this way. That is stupid way. You don't clip this teeth in the wall of the vessel, you put it in the neighboring structure. For better gripping, but according to what is neighboring. If neighboring it is another artery, it will be stupid to use it. If neighboring it is fat or muscle, yeah, you can use it, no any problem. It will give strong fixation. That's all about group number 2. Now your audio book is continuous. I come to the next group. Yeah, I come to the third group. Why you are not smile and laugh when I say your audio book is continuous? Because I just read what is given in your slideshow, nothing more. Let's continue. Now group number 3, as you remember, we call it general. Why such kind of the name? Because they doesn't have specificity. Any kind of the surgery in any regions of human body can use this instrument. And first big group, subgroup inside of group number 3, it is hooks. Otherwise we call it retractors. So what can I do? Come to me. Hold your fingers like this. For example, I make incision. Generally, like his fingers, incision also have same qualities. Look, angles located higher, margins is located lower. Due to the gravity forces, free margins descended to down. Now, I must enlarge this incision. How I do it? There are different ways, but most simple. I apply it into the angles. Then, I don't enlarge anything. I little bit lift. And from the angles, I come to the margins. And now I'm not only enlarged, but of course I am lifting the structures to upwards. How we hold it? It is in your fingers, first fingers oppositely, and in this direction you make the traction. You lift and you tract, and you enlarge. You can see it has 2 tips. One is short, second is long, and both is curved to inside. If you see the hook which is curved to inside, remember it is for wall. It is not for internal organ, because you will be ruptured. Vice versa, if you see hooks which is moved by margins to outside, or which has absolutely smooth surface without any hook-shaped form, it is for internal organs. Biggest one, by the way, I don't have, we call liver mirror. Why mirror? Because you don't only apply, you apply instruments on the body of it, yeah, to not touch to the liver. And you can see your face. That's a liver mirror. Don't worry, don't worry. This is also retractors. Yeah, we call it the French type or the tooth shape. Yeah, they can have sharp tips, blunt tips. If you see such kind of the design of the handles, this is for your second finger. In that position, you can make the traction. Here, inserting your finger. Very traumatical. Usually skin, fatty tissue, not deeper, or bone fragments. If there are, for example, fractures, you can apply it into, or for example, foreign bodies, bullets, or something else. You must make traction to remove. That way, no. But if you will apply it in the vessels and nerves, I think you understand what it is. All this is also, by the way, free choke, very big. It is applied on the ribs to enlarge intercostal space, especially in pediatrical surgery, because for adults it is impossible because of the ossification. But one big problem with all these hooks, you need the assistant. That's an automatical Mikulicz or Gosset type of the retractors. Much more better from that point of view. Why? Because you apply and you work. Nobody doesn't need to apply it and to fix it. Okay, next instruments which I want to show, it is the dissecting forceps. Let's put the instruments in their places to not mix everything. Dissecting forceps, it is, I can say, second most useful. What is the classical picture of any surgeon? In one hand, we have scalpel, yeah. In another hand, we have dissecting. Why dissecting? Because then you need to cut the structures, you need the hole, you need to tense, you need to move. That's it. Usually these two instruments we use together. But not only. I cannot say that this instrument is used only for dissection. No. Generally to fix the structures, to remove foreign bodies, but anything else. That's it is gripping. By the way, we hold it in pen grip position, as you can see. By the way, there are different types. And first main types, it is, you can see here, with the teeth. We call surgical, without, with the grooves, we call anatomical. Of course, this is much more polite. Of course, this is much more traumatical. Let's say, according what do you want to grip. If it is bullet, you can use this one. If it is artery, of course, you will use that one. The French form or pathological form, we take the biopsy or from cadaver or from tumors or anything else. There's a spoon shape, you cut the tissues, then you make microscopical investigation, nothing hard. Spatula, I think everybody see and everybody have experience, especially during stomatological lore or some another practices to push the tongue, to see the pharynx, to see the tonsils. Usually it is the retraction of the structures, pushing of the structures. It can be metallical, such kind of instrument. We can sterilize it use longly. It can be wood, it can be plastic. It is single-using instruments. It's not given, I don't put it in your pictures. This is the bone fixator. We call it Farber fixator. Usually we use it in case of, 1 minute I will go to the skeleton. In case of fractures of deep tubular bone. Now, touch wood, of course, but imagine that there are fractures. Why if I say that? It's very hard trauma. You know, huge amount of the problems. And mortality from the fracture of the tubular bones is very high. There are several reasons. For example, formation of the fat embolism. Pieces of the bone marrow can pass into the lumen of the vessels and can give formation of the trauma, emboli. But anyhow, then this such kind, everything is normal. Then this bones is damaged, then there are fractures due to the constriction of the muscles. Usually it is retracted in abnormal positions. And before immobilization, what is immobilization? Then you fix the bone fragments, yeah, using metallical construction or something else. So you must make traction of the bones to put the normal anatomical position before fixation, yeah. That's why it has sharp tips. That's why you can fix, you can make the tractions. We call sometimes it's crocodile. It's resembling the crocodile mouth, yeah. Crocodile. No, it's a crocodile. Yeah. Props, different kind of the props. We have, this is the simple prop, simple surgical prop. absolutely blunt, and we have measurements in the body. They say, what is the main purpose? Cavities, fistulas, stomas. Let's say, for example, the child is inserted the toy in the nose. Yeah, you can measure how deep is it, what the position of it. Or you open the fistula to outside, but God knows why it is closed. Say, or there are the stitches or scar or something like this. They say you can detect, you can check. Size, of course, can be different: small, big, short, long. So this is unique type of the probe. We call it grooved growth. Now hold your hands like this. For example, this is two layers which I want to cut. And I know that between these two layers there are vessels or nerves. You know, I teach you that first rule of disconnection, say that cut the tissues layer. Now what will be my consequence of work? For example, I need to cut them. They firmly touch to each other. First, what I will do, I will make hydraulical preparation. I will take the Novocaine, lidocaine, I will inject it inside of the loose connective tissue. Due to the volume of the liquid, the layers will be separated. Then I will take the dissecting forceps. I will lift upper layer. By the scalpel, I will perforate it. And I will insert it between the layers, the groove probe. Hold it. What after this? I will take the scalpel. Strongly, I will put the blade in upper looking position. And sliding by this now groove, I will cut upper layer to not damage the lower one. I think it is simple.
So are these grooves for support?
Groove, of course, you will slide by your scalpel along this groove.
Follow the groove.
Along the groove. That's how, of course, it will support all deeper located structures. Huge amount of the towel clips. So you clip the towels. Usually, for example, in that table, you can see the paper towels. We use it for separation of the surgical field. Usually you put two longitudinally, two you put horizontally. Between them you make the quadrangular shape, the surgical field, which is need to be clean, aseptical, antiseptical, some manipulation. But these towels you clip to each other using this instrument. So it is very sharp pointed. Yeah, you clip the towels to each other. To say if there are 4 towels, 4 clips you will use. In the angles between these towel attachment places, you will apply the clip and you will fix the towels in this way.
What is the small one then? This is also covered.
Oh, okay, great question. This is small towel.
Action is the same.
Yeah, of course, but it's small. Very big instrument. We call it Kornzank. Kornzank, this German term. Kornzank can be straight, Kornzank can be curved. Kornzank, usually it is the nurse instrument. She takes from the Bix. Bix, it is the box, metallical box for sterilization of instrument. She takes the instrument and put it in your table. Sometimes we use it to make the tunnelization of the structures using it, but it is not so usual. Okay, let's come to the group number 4. As you remember, we call it special surgical. Special, for example, in this example of 3 instruments, let's understand what is the specificity of them. Special, it means each instrument has only one purpose. For example, these 3 instruments is created for tracheotomy, tracheostomy. We call it tracheotomical collection. Now, what does it mean, tracheotomy? Tomy, it is cutting. What does it mean? Stomy, formation of the fistula. They say, I must to cut, then I must to make the fistula. Both these methods I do to remove the problem, which is called asphyxia, if the person cannot breathe. What is the causes of asphyxia? Of course, we will study in the future. Yeah, for example, foreign body, or for example, allergical reaction, or for example, fracture of the laryngeal cartilages. Huge amount of the problems. What is the single treatment? Below the abstractional place, I must open trachea. In the incision of trachea, I must insert the tube. From this tube, the person will breathe. Before I will remove the main problem, or forever, if the main problem is unremovable. For example, tumor with the metastasis. Cutting of trachea is not simple. If you, for example, cook something by the meat, you know that cartilage is not cut, it's simply from in front and from sides, your trachea is cartilaginous. From behind, it's soft tissue, which is attached to your esophagus. Let's say if you will need to make in the street, for example, tracheotomy, tracheostomy, of course I'm sure in your pocket you will not be these instruments. And if you will not have these instruments, it will be impossible. Now please make the extension of your neck. What can I do in the street? More. Great. What can I do in street? I will fix you, don't worry. You can see thyroid cartilage. You can see cricoid cartilage. You can see depression between them. This is not the cartilage, this is the membrane. We call it, thank you very much. We call it membrana arteriocricoidea. By any sharp instrument, I can perforate it. This is not the cartilage. I don't have special knives. Yeah, there's a piece of glass. I don't know, pen or even anything. And then I inserted the tubular structure. In our pharmacies, even you can buy the tube with sharp tip. Yeah, for the emergency manipulation. So in that point, you perforate it and you exactly insert it. Fortunately for us, the first narrow place where we usually have the obstruction, located above this place, it is the rima glottis, your vocal cords. Because if you will open above the place of obstruction, it will be stupid. But in majority of the cases in the street, of course, you don't have X-ray or something else to understand where is obstruction. So you do it below rima glottis. It is the place which I show for you. But what we can do in condition of the hospital, normal tracheotomy, tracheostomy, I will make skin incision. By the way, usually it is horseshoe shape, or we can say oblique. Why? Because here the Langer lines also have dislocation. You know, it is elastic fibers of your skin. The less you damage, the thinner will be scar. And vice versa. More of this. Then you make the horizontal arcuate shape type of incision. Usually it's located inside of natural skin folds and it's not visible. Vertical descending incision is much more visible after. But anyhow, now I don't want to teach you how to make tracheotomy. We'll study it after. I want to show for you how we use these surgical instruments. Hold it. Now imagine that this is trachea. I cut the skin, subcutaneous fat first, second first. I track the infrahyoid muscles. Now I see the trachea. What after? I take two hooks, one above and one below the place of future incision. Then I take why it's necessary to prevent any movement. If without fixation of trachea you will try to cut it, you will damage the carotid neurovascular bundles, which is located from center. Common carotid artery, internal jugular vein, nervus vagus between them. There are more easy ways to kill the patient. They say don't do it. They say what after this? After this, you take this sharp-pointed scalpel, you remember in the pen gripping position, and very important, separate it approximately 1 centimeter of the blade to not perforate the posterior wall. And by piercing movement, you perforated it. Approximately, you cut 1 or 2 bodies of the cartilages. It is more than enough. If you will perforate it posterior wall, what will be happen? Fistula between trachea and esophagus. And problem which is called aspiration. Part of the foot will pass to the respiratory pathways. Very hard forms of the pneumonias because it will give the inflammation. What after? After you take this instrument, we call it retractor of Trousseau. In closed way, you insert it inside of the aperture, you enlarge it, then you take last your instrument, which is called trichotomy tube. Firstly, you put it in this horizontal plane, then you turn it in the vertical to not damage again posterior wall. And now, after this, you remove your trousseau, you suture the wound up to this instrument, and by these apertures, you fix it by the bandages in the neck to prevent any dislocation. Sometimes it has internal, for example, enlarged portion. We injected liquid or we injected air, and it is open, expanded, and fixed inside of the trachea to prevent the dislocation. Do you understand? Yes. It is connected with injector. You inject the liquid, you expand the balloon, which is connected with the tube, and it makes fixation of it inside of the lumen of trachea. Now about the instrument. The instrument has 2 parts. Look, inner tube, outer tube, and the lock. Why it's necessary? You will clean, you will wash. Slime will close it. And to not remove all the instrument, you will remove only inner tube, you will wash it, and then again you will put it in its place and fix it. According to it, guys, and all another instruments, for example, you can see the rectal mirrors, you can see vaginal little bit bigger. What you're doing, you apply it how you want. For example, you know that the surgical field will be upwards. You will apply in that way. Surgical field will be in right side. You will apply in this way. Here we have lock. You open it how much how you need, or this kind of the lock how much. Sometimes they haven't light to see much more better because it is not so good visible region. That's it. It is enlargement of the natural apertures to make proctological, gynecological, different kind of manipulation.
So is this the same instrument those people use who cannot eat the food? Like they insert something inside the food?
That is for trachea. Air.
You don't eat by the trachea.
No, some people can't eat through the oral.
No. Nobody cannot eat by trachea.
There
By
is-
trachea, you must to breathe. You eat by your esophagus. Esophagus located behind of your trachea. Let's say for eating and for breathing, we have different tubes.
Yes, I was asking, like, is it the same?
No.
Like, there is some tube that is inserted inside the throat for injecting food and stuff.
Nasogastric.
You means about nasogastral, for example, catheters? I don't understand. From nasal cavity, we can insert it catheter into the esophagus, into the stomach, to remove, to evacuate something, or to inject something. For example, the liquid food. For example, for comatose patients who cannot eat, the swallow reflex is absent. So you will insert, or you will open the gastroscope. From the stomach, you will open the tube to outside, and for example, in case of esophageal burnings, chemical burns. If I understand what you ask, I don't know. Okay, let's continue. Now, I want to show for you two instruments. Both we call intestinal clamps. But this one is occlusional, it doesn't crush the structure. This one is crushing.
Traumatic.
Traumatic, yes, of course. For example, you need to resect intestine. That is intestine. Let's draw it in this arching form. For example, here there are two. It may be complete obstruction or portional obstruction. Now, that is not so important. But I must remove it. Yeah, surgery is called. Then I remove part of the intestine. How I call the surgery? We call it resection, guys. In my previous group, just before you, I will not, of course, give the name. There are one very creative person, but you know, he understands the creativeness. Like I like the U.S., but like U.S. peoples, you know, in U.S. schools, teachers usually say to be creative. And children doesn't understand what does it mean. They think that to be creative, it means let's start stupidly to say something. You know, you can be creative only if you have knowledge. If you don't have, for example, do you know the Chinese?
No, sir.
If I will say creatively speak now by Chinese, can you do it? I think it's impossible. Look, it is a simple example which is show that if you want to be creative, you must have the knowledge. If you don't have knowledge and you want to be creative, it is stupid. You can make just only show by that way, but it will be not acceptable for anything normal. Let's say, why I say it? Because I don't need from you now so much. After several days, after several weeks, then you will have some luggage of the knowledge. Yeah, you can be creative, but on the base of that knowledge. Now I just ask you what is written in your lectures. You must just to take it, you must just to study it, and all these terms, if I don't mistake, in first year lecture is given. Yeah, example of the terms. Removing of part of organ, we call resection. So now I must make resection, but that's not enough. Because then I will resect it, this intestine. After I must to make recanalization. We call it anastomosis. That's it. I must to make generally not one surgical technique, but two surgical techniques. First I must to make resectional surgery. Then I must to apply anastomosis. And again, you can say now, sir, but we can do it by single step. Or we can do it by double step surgery. Because what does it mean single step? It means during one performance, I make end access and technique and final suturing. I finish to treat the problem. What does it mean double step? It means I delay my technique into several steps. For example here, what will be main problem here? If it is complete obstruction, proximal portion will be critically enlarged. And distal portion was also, it will be empty, it will be closed. Now I remove this part of intestine. Can I connect it, this huge tube with small? Technically, yeah, but what will be the result? Result will be awful because it is forbidden to apply the sutures on the inflamed structures. It will give the suture insufficiency. That's what I will do. Step number 1, resection, opening of the stoma to outside. Feces will come to outside during several days. It will give the decompression. Size will come to its normal. Then I will make second step, anastomosis. So you can see that the simple surgery we can do according to conditions by single step. And we can do it by double. Or we can do it many steps. Let's call it many steps. But anyhow, I need to make now resection. What kind of intestinal clamps I can use? 2. Primarily, I will apply here 4 intestinal clamps. 1, 2, 3, 4. And these 4 clamps, first and fourth, will be occlusional. Second and third will be crushing. Why? Because occlusional we apply on the non-removable part of the organ. Crushing one, vice versa. Crushing has one important meaning. It crushes all the vessels and the rest all the bleeding in that place. Before I will ligate, before I will suture. Occlusional close only the lumen to prevent formation of the peritonitis. Otherwise, feces will flow inside of the peritoneal cavity and will kill us. Let's say, what after I do? I take the scalpel, I cut the intestine between these intestinal clumps. Now, all these middle compartment with crushing forceps, I remove. Between non-removed portions, of course, we make anesthesia. Again, friends, now I don't teach you how to make the surgery. I teach you how to use the instruments only. So it's not necessary to now study how we make these sutures and anastomosis and anything else. I just show for you how we use the surgical instruments and which surgical instruments we use for such kind of manipulation. Huge amount of perforated, otherwise we call fenestrated type of the forceps. They have the some aperture. Size, form can be different. What is the main value? Fixation, strong fixation, but protection of the structure which will be inside of the aperture. For example, I cannot fix and strongly press the vascular structures because of the rupture and formation of the bleeding. But if I need to remove them, for example, hemorrhoid from anal region, I will apply these hemorrhoidal veins inside of this ring. I will press them. All nutritional veins will be pressed. I will suture and ligate it surrounding and will cut and remove this middle portion. If I will press it, it will be a rupture and give the bleeding. That's why I press it from the sides, not from its midpoint. Catheters, 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 also catheters, urinary catheters. Rubber elastic, metallical strong. Metallical catheter generally used for one case if there are obstruction. If elastic catheter is impossible to be inserted. It also has the Madrid, which is protected inner surface. Yeah? But don't use this metallical catheter. You can say what to do if there are obstruction, for example, tumor. Much more better make the puncture. That's why strongly you palpate upper margin of the pubic symphysis, then the urinary bladder is filled by the urine. According to upper margin by puncture needle, for example, you take this puncture needle. But a little bit more diameter. Yeah? You make puncture, from the lumen of it you inserted the soft catheter, and then you remove the needle, yeah? And from this catheter you evacuated the urine up to decided the problem, or forever. If it will be forever, which kind of surgery it will be? Palliative. So I will not remove the main cause, but I will reduce the sign of symptoms. It will be part. After I will remove the main cause, it will be step of the radical. Again, look, it will be multiple step surgery. By one step, I evacuated the liquid. By second step, I remove the tumor, for example. By third step, I make the plastical reconstruction, for example. Why I don't suggest you to use this one? Strong traumas of the wall of the urethra and long-term inflammation, urethritis. You give antibiotics, problems is decreased. After 2 days, the new inflammation. And again, persisting, chronic. Because the wall is damaged. Don't do it. For oral surgeries, mouth retractor, rubber portions we inserted on the tips, angled strongly outside from the mouth, not in that case, in this case. You put it between molars, you open how you want, it has lock. If the patient has spasms or if it is child that cannot fix any difference. Tissue forceps for fixation. Where is it? Alice tissue forceps. Alice tissue forceps. Where are you? Long one, very long. Alice tissue forceps, uteral forceps. Both is used to fix removable parts of internal organ. Alice usually gastrointestinal, uteral usually uterus. That's why it's uteral. Sharp teeth, it is inserted into the myometrium to fix it. For example, you make extirpation or you make the ectomy in the case of the tumors, cancers. I think it's enough. And if it is enough, I have needle here, big needle. Here is my big needle. Thank you very much. Group number 5, last group. In group, connecting tissue, yeah, of course. There are 2 groups of instruments here. By hand, for hand suture, needles, needle holders, and we have several staplers. I think everybody see the staplers, yeah. Metallical wire inserted into the margins, for example, in skin margins, lung margins, we don't know, internal organ margins. But much more usually we use the hand suturing instruments. Classical needle holder, we call it Hager's needle holder. Like any another instrument with 2 apertures, first, fourth finger, we push, we open, and we fix the needles. How we make the fixation? Now look, needle should be absolutely perpendicular to your needle holder. Needle should be split into 1/3 blunt, 2/3 sharp. And usually, if I'm right-handed, needle is look to left. If I will be left-handed, needle will look to right, and tip is look to upwards. In that position, I take the special thread, not this one, of course, and I inserted it inside of the eye. Yeah, you can see it has the eye. It is so simple. You fix it, you put it into eye, and you insert it. Yeah. In that position, after which position you give? 1/3 it is short, 2/3 it is long. To not provide it both threads from the apertures, yeah, or otherwise you will make the damage. So in that position, I start to make sutures. After I will show, now I don't have time to show this. Give me one dissecting forceps, please. Dissecting forceps. Thank you very much. In this position, let's take the smaller needle, for example, this one. It's much more comfortable for us. Again, absolutely same. Doesn't matter which kind of needle I fix. Absolutely same way. You see? Yeah, and don't work with the open instrument. Close the lock. Otherwise, you can lose your instrument during your work. Now, if it is possible, hold it to prevent any movement. Now look to me. I have here the incision, yeah? How we work? You see pen gripping position? In this pen gripping position, I fix the margin. After this, look here please, I put for my needle absolutely perpendicular. Look, it is perpendicular 90. Don't put it in that way. Don't put it in this way. Don't put it in that way. 90 degree, it means that. You measure the piercing distance, half of the centimeter as you can see. And your movement should be absolutely round. Look, absolutely round, absolutely round, absolutely round. Don't move it straightly. Move it roundly. Again, I show you've made fixation. You put it, you measure the pin. Don't pierce it before measuring. Measure it, pierce it. Now, absolutely same you do in opposite side. You make fixation. Again, you measure the piercing distance. My needle just very short. That's how it is not. You make now fixation of tip. You open your, and even by this your instrument you can remove. Now, if you will look, you will see that we have absolutely equal piercing distances. And I must to start to make the knotting. By the way, I will show you last time. Nowadays, I don't think that my time will be enough. Anyhow, I can do it by instrument. I can do it by hand. Everything is connected. How hard is connect the margins? If it is hard to connect, it means margins far from each other. You will use hand technique, because hand technique we provide under the tension. Then you make knotting by instrument. Look, I make the knot. It is, by the way, surgical. Look at it, twice I turn it. Then I make fixation. And look, don't push this end. Otherwise, you will cut the big pieces of the thread. And after two suturing, your thread will be finished. Vice versa. Then you make the knotting. Yeah? Tense that one. You understand me?
Yes, sir.
And look what I'm doing. I apply the knot on the side of the wound, not in the midpoint, but on the side. If it will be in midpoint, it will irritate it, the margins. Then I open. Look, because my margins doesn't disconnect it, it is not so thick and unmovable part of the skin. Vice versa, it is elastic model, yeah? It's like, now then I lose this pressure, margins is not disconnected. But imagine that you make suture in front operator. You will lose the pressure, margin is disconnected, and that's only hand technique in that way. What does it mean, hand technique? Even by these short pieces, I can make now hand technique. I will teach you, yeah? You take, you make the knot. No, I don't want to tie up to the finish because I will use it. And how many times? Usually 4, 5, because this is monofilament. For the polyfilament threads, 3 will be enough. Let's lose it now. Yeah, and what after? After the same, I will take the scissor, I will measure the tips, I will apply it like this, I will measure, and I will cut. Not by this, it is not cut, but just generally I show for you. Okay? You understand or not?
Yes, sir.
Let's go to my place. Now look for me. Needles. Classified by different characteristics. First of all, such kind of the needles which need to be inserted the thread inside, called traumatical. This kind of the needles which is located in sterile pockets and in factory condition they connected with the thread, they call atraumatical. Of course, it is many times using, you can sterilize it and use it how you need. That is single time using. What is the specificity of this one? Why we call it traumatical? Simply, it has very wide eye. Then you perforated the structure, you make something like this. Huge hole, and only part of the hole occupied by the thread. Huge, big, free distance between the margins and between your thread. If you will try to make such kind of the suture for intestinal wall, fibers will come to outside, and it gives formation of peritonitis. For skin, no problem. For muscles, no problem. But not for the whole organs. Not for the whole organs. Classification number 2. All needles, doesn't matter if it is traumatical or atraumatical, can be straight, can be curved. 99% of needles in the surgery, it is curved needles. Why? Because, hold your fingers like this. I must to take deep structures in the suture. If I have straight needle, it means I will insert it in my hand. For example, this is my straight needle. I must insert my hand together with. and I will damage everything.
Damage,
Thank you
yes.
very much. That's it. For deep structures, simply you can catch deeper structures by round movement and to make suture. But in that case, you can ask me why we need the straight needles for superficial manipulations. Again, hold your finger. For example, then generally you make the sutures. What is after visible, like the scar? Not only the suture line, but piercing points. Yeah, you see one line and points. And exactly, it's not beautiful. That's why we can make a unique type of the suture, which we call intercutaneous suture. Then we provided needle from margins of the wound and don't perforate its skin from outside. Then after, can you connect it now? Yeah. Then after I will close this suture line, thread will be between the margins.
Invisible suture.
So what?
No any piercing points.
How the thread will be removed?
How will be removed? Two cases. In start and in finish, I make the knots.
No.
I will cut both knots.
knots.
From one I will tense, or I will use absorbable threads, which will be disappearing inside of the tissues. Thank you very much. Both situations is possible. Or use absorbable thread, it will be disappearing. But anyhow, it is good because you don't see after these piercing points. Is it understand? Let's remember, please. Traumatical, atraumatical, straight, curved. Next classification, all needles, doesn't matter, traumatical, can be piercing and cutting. If you will make cross-section of piercing needle, like in your home needles, you will see ring. It has absolutely smooth surface and only sharp tip. Only tip is work. Now please, hold your fingers and say me, no, into this needle. Which form it has in your opinion? By two fingers palpate it. Which form it has? Triangle. It has sharp margins. Look. No any round body. Sharp margins. So that's why, tell me please, in which conditions you will prefer to use this needle, which is called cutting, and in which condition the round body needle, which is, by the way, both can be curved and straight. For skin, which one you will use? Why? Because of high elasticity. Now imagine that you need to perforate this rubber structure. If you have piercing needle, you will break it. Because I must not only to pierce, but I must to cut a little bit it. You understand me? Vice versa, you work with the intestine. Am I need to make the big hole? No, of course not. Even by finger I can perforate it. Why I need the piercing one? It's understandable. And last classification, needles, we can divide it into sharp pointed and blunt pointed. Blunt pointed, usually, we use to suture the parenchyma disorders, like liver. Even by your finger, you can perforate it, but inside of it, we have tubes, which is not need to be perforated. For example, our bile system. If I will use blunt pointed, then it will touch to it, it will press it, and will not perforate it. If I will use sharp pointed, I'm perforating the bile will come to outside, will make the problem. Yeah, possible complications, of course. Finally, threads. Of course, thread it is not the instrument, it is material. And this, by the way, nowadays, then you take the atraumatical, all information is written. Now, for example, you can see 1 second of the circle, curved cutting, length 23 millimeters. About thread is written polypropylene, non-absorbable suture. So all information, metrical system, even metrical size 30. So everything is given. What does it mean? For example, 1 second of the circle. It is semi-round. Or it can be 2/3 of the circle, more curved, or vice versa, less bow-shaped form. Yeah. So everything is written. According to it, all our threads we can divide into monofiber, polyfiber. For example, that is the polyfiber. Of course, you can say it's not medical. Doesn't matter. We have a medical. Look, I disconnected into the fibers. You see how many fibers it has. 3, 4, doesn't matter how many. There are polyfibers. They rotated to each other, or they can be, how we can say, how your hair is. In that way, they can be connected to it. But anyhow, they have one big problem. Between fibers, we have spaces. We call it narrow capillary spaces. Do you make in your school a simple experiment? Then you inserted the capillary into glass of the water, and water goes upwards by this capillary. Because of the adhesive qualities of the molecules. Molecules connected with these glass walls and goes to the upwards against the gravity forces. That's why if you will use this kind of the threads for the intestine, for example, liquids will come to outside. But in the same time, it is good. I like to work. Why? Because it doesn't have memory. What does it mean? I put it in straight position, it is hold its position. Try to give the straight position for this one. Look, whoppa. Memory. Thread memory. Then you make the knot, it is simultaneously open. That's why you will apply more knots, up to 6 for this one, to make the fixation. For that one, 3 is enough. So don't say what is better, what is not so much. Each one has special indications, applications. There's a single thread, polyfilament. Second one, organical, non-organical. Non-organical wires usually. Organicals can be natural, synthetical. For example, this is the first synthetical. Natural, for example, silk, catgut, or something like that. And finally, absorbable, non-absorbable. Yeah, it can be absorbed during. By the way, time of absorption can differ from 10 days minimum up to 1 year. We are break time today is enough. All instruments I finished. Why I say enough? I don't want to start to give for you sutures and knottings because I need more than 1.5 hours. You understand me?
Yes. So I have a doubt. Like intestine lumen is very thin, right? Rather than
Lumen or wall?
No, the wall. It is very thin. So when we make any surgery, rather than suturing, can be connected by forceps? Like,
Finally.
no, yeah. In the end,
Finally. Finally.
To
Finally, no. Temporally, yes.
Yes.
Temporally, yes. Finally, of course, no. Otherwise, the content will be, pressure will be increased. It will destroy this connection and will come to outside. By the forceps is even skin we
Skin
don't
can be-
find. We try to, I know some surgeons like to, especially they take these surgical types of forceps, clip and press it, but you know, usually it gives ugly big scars after. Because during the regenerational time, margins is slide from each other,
Yeah.
distance between them is enlarged, and it gives the ugly scar. Techniques we have such kinds, but I don't suggest you to use, and especially not for intestine. More minimal layers of the sutures, it is 2 for intestine. We apply firstly infected suture and we close it by sterile to prevent any possible passage of infection. If you will do such kind of the things, the chance of the mortality, you will increase the mortality.